Hello everyone, I'm Divya from Valley and I was in the pharmacy track here in the Physical Professional Lawyers program.
Hi, I'm Nicole Wing. I am from the medical track.
Hi, I'm Vash. I live from the social work track.
And this is Sarah Coleman, she was in the nursing track. There are 318.9 million people living in the United States of America today. 29.1 million of these people have diabetes, and nearly 1/3 of them don't even know they have it. What's worse is that our country spends approximately $174 billion every year trying to treat one of the most preventable illnesses known to mankind, diabetes. But even so, diabetes still stands as the first leading cause of blindness and the third leading cause of death in the United States. The key to treatment is simple. It's education. We have to educate three sectors of the population: the pre-diabetics, the diabetics, and the general public. But before we go into how we plan on educating the public, here's a little bit of background information on type 2 diabetes.
So type 2 diabetes is a metabolic disorder in which the body does not properly use insulin. So this happens when the body develops a tolerance to insulin due to too much sugar in the diet. Therefore, the insulin is not the problem, pancreas is not the problem, it is the overload of sugar in the diet. So as you guys may hear a billion times today, there are three types of diabetes: type 1, type 2, and gestational. So some common symptoms of these types include excessive thirst, frequent urination, and fatigue.
So now that you have some background information on what type 2 diabetes is, here's how we plan on combating this issue. Our idea is an educational reform program called Sugar Rehab. Sugar Rehab is a program that provides a holistic education to diabetes awareness. It has two major subprograms: camp prevention and camp attention. Camp prevention is targeted towards educating the pre-diabetics, and camp attention is targeted towards educating the diabetics. Both camps have three major focus points: nutrition and health, which is the greatest of the three; counseling, which is the second largest; and exercise, which is the third largest. Both camps will run for 5 days in the month of November, which is National Diabetes Month. They will be running simultaneously but in separate classrooms. They will be taught by a host of healthcare professionals, including but not limited to physicians, physician assistants, dietitians, nurses, and several others. So now we will talk about what will be covered every day in both the camps very briefly. So we're going to talk about camp prevention, the pre-diabetics camp first, and then we'll move on to camp prevention.
Today, for both camps will be identical. We will first identify the current diets and explain to them what are wrong. We will also explain what is the difference between diabetes and pre-diabetes. We also will pose questions to them like, what kind of exercises do you guys like to do and what can you change about?
For day 2, it is also identical for both camp prevention and camp attention. So for the nutrition and health section, you'll be going over the importance of macromolecules in diabetes, and then the glycemic index and how it is important that you eat foods that are that have a low glycemic index rather than a high glycemic index. So for counseling, we will go over pretty much from ground up, have the participants explain their feelings on how diabetes has affected their own lifestyle, and then help them build some self-confidence and self-esteem. So then for exercise, we will make it very important that it is nutrition that is important in regulating your blood glucose levels rather than exercise. So you want nutrition to be the most important part of your lifestyle instead of exercise. And then despite this, we will have examples of exercise routines so you can help stress management.
For day 3, we will have dietitians come in and lead a program and activity that will help our participants make a healthy meal plan. We also will change these meal plans throughout the course of the camp. We will also have physician assistants come in and acknowledge the frightening impacts of not having a healthy diet. For day 4, we will have nutrition and health segments that will make recipes that they have also made the day before. We will conduct a biochemistry test, also make appropriate edits to the diet because of the results. In the counseling and social work, we will talk about stress management techniques through the cognitive behavioral therapy.
So day 5 is the last day of this camp prevention. And We will start off with the nutrition and health segment, which will be led by the dietitians, and they will discuss portion control. Portion control is basically learning how to regulate what you eat, and we felt that this would be perfect on the 5th day, the final day of the camp, because of a couple of reasons. From days 1 through 5, people of the camp prevention have been identifying their diet, and they've been making modifications to it to make it tailor to their specific needs. They've been taking what they already eat, and they've simply been adjusting some of their foods based on what they've been learning from some of the experiments and the lectures. So with portion control, they're going to take their diet that already has a list of the foods that they should be following, and will simply be adjusting how much extra food they eat. And dietitians will start educating about the DASH diet through, we'll start educating about portion control through something called the DASH diet. The DASH diet essentially describes a bunch of different types of diets and how much of and they tell how much each type of food should be eaten to make the stomach more fuller on the healthier foods and less full on the unhealthier foods. For the counseling segment, social workers will conduct family therapy sessions. Essentially, the families of the pre-diabetics and the diabetics will be invited to sit down and talk to the social workers, and they will learn about what they can do to make the life of the diabetic and the pre-diabetic a lot easier. We will talk about increasing cohesion among the family, increasing the sense of communication, and making the patient understand that they are not alone in their struggles. So with this, we have concluded camp prevention, and now we will talk about camp attention. And camp attention and camp prevention are very, very similar, even though they are different. Days 1, 2, and part of 5 are the exact same, so we will start talking about days 3 and 4 for camp attention and the minor differences there in day 5.
In the nutrition and health segment, there will be a urinalysis and blood test being done. 2 different tests of urine and blood will be tested to identify the glucose level, the ketone level, and the pH level of each individual who are pre-diabetic, diabetic, and healthy. The social worker will discuss how diabetes will affect you, your family, and your lifestyle. Also, we're trying to teach the patient that diabetes isn't their fault.
And then so for day 4, for attention, we will be going over for nutrition and health, hypoglycemia. So hypoglycemia, if you do not know already, is when there is too little blood sugar and too much insulin in the bloodstream. So this can happen when you skip meals or you have too hard of an exercise routine. And then, so ending this section, we will have a driving simulation activity with the participants, and it will just show them the dangers of driving under the impression of having hypoglycemia.
So day 5, as I already mentioned, is almost the exact same as it is for camp prevention, but there's a slight difference in the counseling segment for camp attention for the diabetic students. So they will have the opportunity to work with biomedical engineers and discuss different insulin delivery devices, both invasive, meaning for the use of needles, and non-invasive, meaning for the use of nasal sprays and other means. They will talk about what type of device might be most helpful for them and most comfortable for them to use on a daily basis. They will also have the opportunity to talk to pharmacists about different types of medications that can be used to accompany their diet plans. They will mostly talk about metformin, which is the most prescribed medication for diabetics, and it helps them improve their body tissue sensitivities to insulin. So with that, we've concluded day 5. We concluded camp prevention, pre-diabetics camp, and camp attention, diabetics camp, and sugar rehab. We've addressed 2 major themes: educating the pre-diabetics through camp prevention and educating the diabetics through camp attention. But we have not yet talked about how we're going to educate the general public. This will happen on the culminating event to be held on November 14th, American Diabetes Day, and this event will be known as Sugar Rehab.
Sugar Rush is a national event. It's a 5K run in the morning, followed by Paralympics for the individuals who have prosthetic limbs, and it's a social walk around the track. This one will be founded by volunteer sponsors, different businesses and organizations. The social activity will have children's stations, a live DJ, and a live cooking station. Sugar Rush is entitled to have a fun and educational purpose and help others connect who have the same symptoms.
So essentially, the key to treating diabetes here lies in education. Through Sugar Rehab, we will educate the pre-diabetics and the diabetics, and through Sugar Run, we will raise the awareness of diabetes to the general public, and they will start to understand through watching the Paralympics, which is meant for those individuals who have prosthetic limbs as a result of diabetes, what the effect of diabetes can end up leading to if we don't take enough care of ourselves. Diabetes is one of the most preventable illnesses known to mankind, but yet it's something we spend a lot of money on every year, and through education, we can definitely make sure that that is not the case anymore. Thank you.